Hi, everyone. Welcome to the House Democratic Caucus. Something we are not going to do today is talk about education. We figure with the caucus of the whole and the office hours that are coming up, we don't need to take away from your lunch for that. But we do have some important bills coming out of healthcare. So we're going to have Rep. Black come up and tell us about those. And then we'll be done. I'm not even going to do announcements.
This is going to be the shortest caucus ever, if you don't ask questions. So last week we had voted out 3 bills. You got to hear the riveting report on VSA 8, Chapter 107 today being updated. But we have 2 bills. I'll start with S18, which is currently in Ways and Means. I think it's up in their committee for tomorrow. They're going to be looking at that and possibly voting on it. So maybe Friday on the floor, if I have my calendars right. So this is licensure of freestanding birth centers. If you've been around for a while, this is a bill that has been kicking around for biennium after biennium. The Senate moved on it. We took this up. Essentially what it does is it creates a licensure process within the Department of Health. It creates a definition of what a freestanding birth center is. And if anyone doesn't, I'll give you the definition. It's right here. A facility that's primary purpose are to provide midwifery care, low-risk deliveries, and newborn care immediately after delivery. And it's a stay that's generally less than 24 hours. It is not a hospital. It is not affiliated with a hospital, even if it happens to be freestanding. And a description of these, we actually did a virtual tour of one. Think of a home-like setting that certified midwives normally would be doing home births. This brings it into sort of a home-like setting where there are the resources, equipment, plans in place to provide that comfortable setting for a birthing person that they may wish to have. Currently, the state of Vermont is one of only 7 states that does not allow this, which means we have relegated birthing people to 2 settings. You may either give birth in a hospital or you may give birth in your home. And those are the only 2 options. And we feel as though we need to provide this 3rd option so that pregnant people have choice in where and the setting that they wish to give birth. So anyways, it sets up a process for licensing of freestanding birthing centers through the Department of Health, a whole rulemaking process. It's currently in Ways and Means right now because there's a fee. There's an inspection process that they will undertake, which is actually done through Dale, just like we inspect any kind of medical facility, nursing homes, anything like that. It then provides, so that's sort of the licensure piece. We already require that midwifery services are covered. It allows for some amendments to statute to ensure that the coverage of midwifery services are covered in a birthing center as well as in homes and hospitals. It has a section in here that exempts birthing centers from the CON process, Certificate of Need process. And if you recall, we did a bill, I don't know how long ago it was, a month or so ago, on Certificate of Need process through the Green Mountain Care Board. We raised the income thresholds. So these are such small facilities that they would never trigger the thresholds anyways, unless somebody was creating some massive birthing center, but frankly, with the birth rate in our state, that's unlikely. And this actually exempts freestanding birthing centers from the CON process, just like all sorts of other types of healthcare services are. physicians' offices, things like that. So it exempts them from that process. And then it just has that Medicaid will seek approval from CMS because Medicaid needs approval on everything from CMS to provide coverage in a birthing center. Currently, we don't have that because we don't have any birthing centers. So anyways, that's the bill and hope we can get support on it. It came out of our committee 1100. So any questions?
Hi, Representative Rowe, Windsor Four District, the Southeast England. I'm one of those people that have been introducing this bill for several sessions now, and I'm really glad to see it. I live halfway between Brattleboro and Springfield. Springfield is the hospital that closed its birthing center several years ago. So this would really be a great option for people in that area, and I'm sure across the state as well. But thank you for doing this. I look forward to supporting this.
Great.
Michelle Basil, Wyndham 3, right next door to Wyndham 4. And I actually fully support the idea of this. I just have a question. You mentioned that the freestanding birth centers wouldn't have any affiliation with any hospitals. And I guess I'm wondering why that is. I mean, even nurse midwives that are doing home births often have a backup plan for going to the hospital if something goes wrong. So why aren't there any kind of affiliations or connections with the hospitals?
In the rulemaking process, freestanding birth centers actually do have to have written agreements and rules for transport to hospitals. So there is that, but it's the definition of a freestanding birth center. It's just that it's not owned and operated by a hospital.
That's fine.
Yeah, that's it.
Thanks, Dodge of Essex. I imagine that this might be. That this might create quite a bit of savings in terms of cost for and usage in hospitals, and I would imagine also staffing and staffing shortages. It feels like a good response to a lot of the challenges that we're facing.
Well, I will say that insurers are fully in support of this. We took testimony, the average, and this is just the facility fee. So it's important to remember that, costs are different between providers and facilities. Right now, the average facility fee for a uncomplicated birth in a hospital, we heard some as close to $17,000. A birthing center, because there are birthing centers along our borders. And they are utilized by Vermonters along our borders, and the costs range around $2,000 to $3,000. So it's a significant savings, but it's also really important. We did not hear any testimony, and we asked this question a lot. And in other states, which is almost all of them, except for us and 7 others, we don't really anticipate that this will take births out of hospitals. We're really more anticipating that this will provide an option for people who are going to another state, New Hampshire, Massachusetts, and it will provide them a facility closer to home in where they're more comfortable. Or what it may do is it may take away home births, not take away, but it may reduce home births. We really haven't seen we didn't see any evidence that it's going to start taking hospitals births. So, because I know that's a concern.
This mic is not great, but I think it's helping people online to hear, so stick with it.
Hello, Graham Klutner from Burlington. I just rise in support of this bill. I had two children who were born in Vermont, one in the hospital and one at home, which, as the presenter pointed out, are the only two options. My other two children were both born in birthing centers outside of Vermont, and it is wonderful to have all three options so that each person giving birth can choose the one that is just right for that time.
Yeah. Representative Brady from Williston, I apologize if I missed this. Did you have testimony from the Green Mountain Care Board, or have they weighed in on this? And I am admittedly coming kind of from the fray, being deep in education, and the policy sounds good, but worried about our challenges of scale. We have challenges of scale in schools, and worried that this feels a little bit like a kind of counter to the challenges of scale we have also within our healthcare system.
We heard from the Green Mountain Care Board, specifically regarding around the CON process, which is what they administer. They are 100% fully in support of this. And if you want to reference the Wyman report, which was the Act 167 report that was put out, one of the first things that they said to create more competition and lower costs is Vermont needs freestanding birth centers. So Green Mountain Care Board fully in support.
All right, next one.
All right, so the next one is S27, which is medical debt relief. This is currently in appropriations. I think I saw it on their schedule for Thursday. So hopefully that will be coming to the floor soon after that. So this is, I will say this is a bill that was put forward from the state treasurer's office. The state treasurer has, well, we heard from Rhode Island. Rhode Island has done this. There is a nonprofit company, Undo Medical Debt. And what they do is they go and they purchase for pennies on the dollar, bad debt that has already been written off. But people have been sent to collections. It is on their credit reports. And what they do is they go and they buy that debt, and that person is relieved of the debt and it's removed from their credit reports. This takes $1 million from the treasurer's office. Apparently, during COVID, the treasurer's office had been appropriated many millions of dollars, which for a purpose that did not get used. And he has asked that they be able to use $1 million of this. They are anticipating, estimates are that this $1 million could buy down over $100 million worth of bad debt that Vermonters have. It will make an enormous amount of difference in people's lives. There are income guidelines. It's 400, people eligible would be under 400% of the federal poverty level. Undo Medical Debt, which is the nonprofit, is been doing this for years, very successful at this, very successful at paying down the debt and removing it from credit reports. This is kind of a win-win for a lot of people. And again, this was voted out 11-0-0. So that's coming to the floor. Maybe next week. Okay.
Does anyone have any questions? After that, I'd like to use the microphone. Any questions? Great, thanks, Alyssa. That is it.